Good evening. My name is Liz Hall. I lead public policy and issues management at Anthem, and I am proud to serve on the board of the Alliance for Health Policy. For decades, healthcare is focused on only a small part of who we are. But the data is clear that our health is impacted by our broader experiences, and most of those occur outside of the doctor's office. That's why Anthem is refocusing how we support the health of our members and communities with this more holistic approach. But we know this is a community effort, and we can all be more effective by working together. We look forward to working with all of you and other stakeholders and partners to create a more inclusive approach to healthcare, one that improves outcomes while driving health equity. Thank you, and enjoy the rest of the evening.
Thanks so much, Liz, and thank you everybody for tuning back in. I am really pleased to be back with you to close out the afternoon with our final sessions from Voices from the Frontlines. We are so honored to be recognizing the medical community and speaking with the team that treated U.S. patient zero. They were truly on the front lines of caring for that very first known patient. From the start, frontline health workers have been at the forefront of this pandemic, risking their own lives in the face of this virus while upholding their solemn oath and their commitment to saving lives. They diligently put patient needs above their own, constantly adapting to new information, protocols, and treatments, while also providing comfort to isolated patients and distraught loved ones. We applaud their stamina, dedication, and sacrifice, and we're honored to have some of them here with us today. And with that, let me introduce today's medical community honorees. Dr. George Diaz serves as the Division Chief of Medicine at the Providence Regional Medical Center Everett and is a practicing infectious disease provider. In January 2020, Dr. Diaz treated patient zero, the first known patient to be hospitalized with symptoms of COVID in the U.S., along with his care team in Everett. He enrolled patients in clinical trials, testing the use of the antiviral drug remdesivir, and went on to become the first doctor in the world to use remdesivir for the treatment of COVID pneumonia. Dr. Diaz also helped develop Providence's COVID telehealth home monitoring program in rapid response to the pandemic to connect with traditionally underserved populations in the community. Next, I'm so pleased to introduce Robin Addison, who has worked in the emergency department at Providence Regional Medical Center Everett since 2005. And she's a nurse and was one of the founding members of the Biocontainment Evaluation and Specialty Treatment, or BEST team, during the Ebola outbreak in 2014 and 15. Robin is now clinical lead for the BEST team and works on recruitment and training of new staff, as well as keeping the unit in a state of readiness. Last year, she was part of Dr. Diaz's team in carrying out the groundbreaking work of treating patient zero. I'm also pleased to introduce Sarah Wilkerson. She is the Washington and Montana Regional Director for Infection Prevention at Providence. She's been a nurse for over 11 years, starting her career in the operating room before returning to her studies and completing her Master of Nursing. She is also certified in infection control. Sarah was another key provider in treating patient zero and is co-author of the article, First Case of 2019 Novel Coronavirus in the United States, published in the New England Journal of Medicine. So George, Robin, Sarah, welcome.
Hi, thanks for having us.
It's so wonderful to have you here. So let me begin by asking Sarah Wilkerson. Sarah, can you describe the moment when you realized you would be the team to treat the first known COVID patient in the United States? And when did it occur? And what was going through your mind? And we can start with you, since I know you were helping to set up that unit. And then I would love to ask that of your teammates.
Yeah, great. Thank you, Sarah, so much for having us today. We're really honored to be here and be able to share our experience. So yeah, I remember the moment vividly. I think I always will. I received a call as I was headed to bed on a Monday evening from our hospital administration, and they had been notified by our local public health that the first confirmed novel coronavirus case in the United States was in our county and needed to be admitted to the hospital. My initial thought was, oh my gosh, what are we going to do? But then I took a deep breath and I thought, okay, here we go. It's time to open our biocontainment unit. We have a dedicated team, as you mentioned, that Robin and I help to lead, that has been trained to care for patients with highly infectious diseases, someone with Ebola. But we had not had a chance or an opportunity to open our biocontainment unit to a patient until now. And so, that was a little bit of a learning opportunity for us. But, the more that we thought about this disease and how new it was and how much was unknown at that time, it really seemed like the safest option. So we had actually discussed earlier that day that we thought we would likely see somebody with novel coronavirus or something like that versus Ebola come through our doors. We just didn't think it was going to happen that night. The next step was really to get the rest of the team on board. So I contacted Robin, Dr. Diaz, and let them know what the situation was. And the plan, and we really just jumped into action. I'm still so proud looking back at how our team worked together so collaboratively, how quickly we were able to get the patient to the hospital, and then just all the great energy working together, and just such an ever-changing climate, and having an opportunity to work with different parts of public health that we had not before. But just also the way the team was so innovative with ways that we can improve our safety for both the patient and the staff.
Thank you so much. And Robin, you'd been involved in setting up that unit. What did it feel like to know, like, this is it, this is the moment we're opening it up?
Well, like Sarah, I was on my way to bed that evening. It was a Monday evening during flu season, so I'd been at work since 6:30 in the morning and was tired and had enough of that day. So when Sarah phoned me, my first thought was, holy cow, this can't be real, because we'd joked about it not 6 hours prior to that. And we'd actually sent a page out to our team. We send a monthly test page out to our team, and that had gone out. So, my next thought was, wow, I wonder if anybody's going to respond if we page them, because they've already gotten their test for the day. They're going to think that this is just a glitch in the system. But luckily for us, everything just fell together amazingly well. We were able to get the unit emptied of patients, because the area where we treat our biocontainment unit is a patient unit that we transfer over to isolation precautions. So we have to move existing patients elsewhere in order to set up for our use. So we were able to get the patients out of there very quickly. The maintenance people that were on had practiced setting up our walls, and were able to get that up easily. We had a tabletop drill with the county 2-3 weeks prior. And so when we contacted the local health jurisdiction, EMS, everybody had already talked through what they would do, albeit for an Ebola patient, but even so, they all just jumped in and did exactly what they had said they would do at our drill. So it worked out remarkably well.
Thank you so much. And Dr. Diaz, someone you train your whole medical career for a moment like this. What is that like for you?
Yeah, it was a topic of conversation. I had been at the IDSA Fellows Conference that weekend before the first patient, and that was sort of the buzz, is that what was going on in China was really the big news there. And at least at Providence, we have 50 hospitals on the West Coast, and so we had already sort of been thinking about it, and our team locally was prepared for it. But when I got the call, I knew our team was ready. Sarah and Robin had been doing an amazing job getting our local operations in place to take care of a patient like this. So that part was straightforward in terms of how we're going to manage this patient ourselves. But really the question became, okay, how are we going to manage this on the West Coast? How are we going to create the systems in place to make sure that we find these patients within one of our health care settings on the West Coast? And how are we going to manage the volumes of patients that are going to come in? Because we knew it was just patient 0, but there was going to be patient 1, 2, 3 to infinity coming right afterwards. And so my thoughts turned to really the health system. How are we going to address the incoming wave of patients?
I have to say, I am so struck by the calm with which you all explained this moment, which I'm sure you had some adrenaline that had to kick in, but it just speaks so much to your professionalism and training and readiness. And Dr. Diaz, Robin mentioned contacting local health department, and since we just heard from public health experts at the federal, state, and local levels, I'm curious if you could speak to how did that work for you? What kind of support or collaboration did you have with the public health infrastructure as a health system yourself?
Yeah, I mean, I think at least within our county, in Snohomish County, we have a really good relationship with our county public health department. We interact with them multiple times a week, and so there are partners on the ground for many things that we deal with. But this was the first instance that I've been involved where both state and federal public health was also involved, and they both provided a lot of direct support for us, which was great. The CDC sent a team out on the ground with us to help us manage our patient as well as provide support. And so did the state health department. And so that was the first time I witnessed firsthand the interaction between a health system, county, state, and federal public health all working together in the same direction. And I think the collaboration really, at least on patient zero, was amazing. There was fantastic collaboration because we were all on the same page, moving in the same direction.
Thanks. And I'm curious if you all could speak to, and maybe I'll ask Robin and then Sarah this too. I mean, Dr. Diaz, you alluded to, you knew this was patient zero, but there was going to be more. There was going to be more coming. And obviously we were all really worried, especially at the beginning, about hospital capacity and how that was all going to play out. So when did you notice? I mean, was there a moment when you knew like this was going to be really bad and there was going to be a real problem with, potentially flooding the hospitals, as maybe didn't happen with Ebola, but certainly was a risk with this one?
Yeah, I'll let them answer. But the moment that I sort of knew that this was going to be really bad was when the Chinese began closing large cities to travel. Big cities like Wuhan and other areas were absolutely shut down. They did that for a reason, and the reason was this was going to be extremely difficult to contain, and the number of patients potentially was going to increase rapidly, not just in China, but all over the world. And so seeing the Chinese lock down all their major cities was really eye-opening for me.
Yeah, thanks. And Robin, what about you? I mean, you were an emergency room department nurse, so you were really seeing folks as they came in. When did you realize this was going to be as bad as it was?
So for me, it was a few weeks later. We had our first patient. He went home after a 10 or 12 day stretch in the hospital, and we all kind of took a deep breath and thought, okay, that was interesting, and started talking about what the next steps were. So a couple of weeks later, Sarah and I were actually in a studio making a video for donning and doffing personal protective equipment for the future patients. And about halfway through that, Sarah got a text and she's like, I'll be right there, you keep going. So I kept doing my part of this video, and she finished up with her call and came back and said, we've got to go back up to Everett because another patient has just shown up in the ER. And after that, it just snowballed, and patients and patients and patients after that.
Sarah, what about for you? I mean, you like, how many people is this biocontainment unit supposed to hold in the first place? I mean, like, how did it feel to know? I mean, I can imagine it was not able to contain, right? Like the pandemic. Right. What happened? And can you share that story?
Yeah, so the unit's really only meant to care for 1 to 2 people, and it's very isolated specifically for that reason. And so, as Robin mentioned, after the patient discharged, we had a moment to take a breath. I think we started to think, okay, we need to look at surge and what's this going to look like, and really identified areas in our main hospital where we knew we could quickly convert rooms to negative pressure, that we could, separate from other patients. And so really worked with our administration team as soon as we could to identify those key areas, and then also just to kind of collate all of the things that we learned with that first patient and start to put together plans for the next patient. So just for an example, we created something called a line box, which had everything that somebody would need if they had another patient walk through the emergency room or something like that. And so the staff could immediately grab all the supplies that they needed and admit a patient to a room and know that they were well protected with the PPE that they needed, the identification for precautions, and just communication with the team. So that was really great to have that administrative support and be able to get that plan moving forward. Because as Robin said, once we had one, then we had 30, and then we had more, and we had more, and we had more. So, we had to be able to expand that plan ongoing and figure out how to keep up with the increase of patients.
Yeah, and at the beginning, particularly at the beginning, we started to run out of PPE. Did that happen at your hospital? And I want to ask, like, what goes through someone's mind, like, as that caregiver, as that person on the front lines, when you don't have what you need? Robin, you want to start?
Sure. We are very lucky here. We're part of a large organization, a very large organization. So PPE was never an issue. There was people in the back, and they deserve every award in the book because they were able to get us everything we need. And, even got very innovative with things. We have a long-standing relationship in Everett here with a furniture company who volunteered to make us masks and face shields if we needed them. I think so. People would go home and they would look on the news and they would see all of these horror stories about running out of PPE. So there was a lot of anxiety around it, but we never actually had a problem here, which was really comforting.
That's great. Certainly speaks to the ingenuity and kind of some of the creative partnerships that were that were started as a result of sort of necessity. I want to also ask, like, and Dr. Diaz, I'll turn to you for this one. When the pandemic first hit, we saw reports of rallies supporting the medical community and people bringing sandwiches and sort of cheering at 7 o'clock every night, and the country really rallied with support and admiration. What is that like? What is it like now? What is going on? Do you think that the doctors and nurses and infectious disease specialists are still feeling supported, or has the tone shifted? And is there a new sense of normal?
Yeah, I think the tone has shifted. The patients that are now being admitted to the hospital primarily, and the ones that unfortunately die, are patients that are unvaccinated. And unfortunately, these patients and their families have beliefs based on faulty information that they receive from media. They get advice about vaccines that's inaccurate. They get information about treatments that are inaccurate, things like ivermectin. And so we see many of these patients and their families demanding treatments like with things like ivermectin, which the FDA, the CDC, the IDSA are all recommending against. And it's based on this belief in an alternate reality that doesn't exist. And there's a lot of aggression in these beliefs. And as you've seen around the country, there have been patients who have been suing hospitals to get access to treatments that are not being recommended by medical experts, the NIH, IDSA. And this generates a lot of anger at healthcare providers for not providing those types of treatments. Likewise, because of this misinformation that occurs with respect to vaccination, there are people that are opposed to the mandates that have occurred around the country for example, healthcare providers to be vaccinated. And at our hospital, we have had demonstrations right outside of our building by people that are against vaccination who are protesting that we're vaccinating our healthcare workers. And this also unfortunately results in threats to our nursing staff and other providers as well, from patients and families that live in an alternate universe with respect to the treatment and prevention of COVID-19. And they're very vocal. And this has definitely caused a shift in what healthcare workers are seeing and the stresses that they're undergoing right now on the front lines.
Thank you for sharing that. And, so sorry that this is happening to you and to your colleagues. And I wonder, I wonder if you could share for the public here and those who are listening, like, what is the hardest thing you have to do on the front lines as a physician?
I think, at least personally for me, the hardest part of this is when our patients are dying. The current virus, the Delta variant, appears to be more lethal than the prior variants, and it's also more contagious. And so what we're seeing now is younger people going on ventilators and dying from the disease, whereas before it was mostly people that were older that were before the vaccine was available. And so now, unfortunately, we're telling families of patients who have children, school-age children, that their dad or their mother's dying. So this new variant is really traumatizing much younger people, and I think that's very traumatic for everyone involved.
And Robin, as an emergency department nurse, you mentioned you were already exhausted, like from day one, from how hard you'd been working, and it certainly still remains extremely challenging. And we've heard so much about the burnout factor and the mental health of those who serve on the front lines. Like, how do you go on day in and day out? How do you and your colleagues, kind of cope and remain there on the front lines?
I've asked myself that question more than once over the last couple of years. Our staff, our emergency department staff, are amazing. We are very supportive, very tightly knit group. And we do try and make a point of lifting each other up when we can. We emphasize the importance of getting time away. I'm an avid hiker, and I spend every moment I can well out of cell service and away from the media. And we really promote, for staff to do whatever it is they need to do to take the way to the hospital off and go and do whatever it is that they need to do to keep going. But we're tired. We are. Everybody is tired. I know certainly in the emergency department, we're on I lost count of waves, I think fourth and a half wave. But in between those waves, we get huge numbers of patients showing up without COVID, who have been postponing stuff and are sicker because they have not wanted to come to the hospital or not been able to come to the hospital because of the pandemic. So the ER, I'm speaking selfishly here, but we have not had a break in 22 months.
And what do you think you most need from the American people right now?
Patience and kindness. That's it. People need to remember that behind the masks and the cappers, we're human beings, and they need to, we're working as hard as we can and we're doing the best we can. And they just need to accept that it's not like it was 2.5 years ago.
Yeah, thank you. Sarah, you had mentioned the teamwork, and you've all mentioned the amazing team that you have. I'm wondering if what you do to keep that going, and what gives you hope in moving forward with this pandemic.
Yeah, good question. I mean, early on, we made sure that we offered time for the team to, express what concerns or ideas they had, and we've tried to continue to do that. Really trying to see what they need to help them keep going. Like Robin said, just finding ways to lift each other up and be there for each other. And, you know, early on, we were working crazy hours every single day, and we thought there was going to be an end at the, you know, end of this. And unfortunately, it doesn't appear that that's going to be the case. So now, similar to what Robin mentioned, just really trying to take a step back and think about why we do the work that we do, and remembering what our purpose is, and that what we do makes a difference in our patients' lives. But we also have to stop and take care of ourselves. We've got to figure out a way to balance our work and our life and reconnect with the, you know, our friends and family that we've lost touch with because we've been working so many hours, and really find a way to heal ourselves and to fill our own cups. Because if we, you know, don't take care of ourselves, we won't be able to take care of anyone else.
Yeah, thank you. I'm guessing these are things that they don't teach you in infection prevention certification.
Definitely above and beyond what, you know, what I thought my role would be.
Yeah, absolutely. Well, in the few minutes that we have left, I want to ask each of you briefly to share your message with America on behalf of the medical community. Of course, we know, you know, from coast to coast and in urban and rural areas, there are probably people on ventilators right now as we speak, people coming into the ER, hopefully people being discharged, you know, but the work continues. What would you like to say to your colleagues? Dr. Diaz, would you like to start?
Sure. Right now, the vast majority of the patients that are in our hospital shouldn't even be there. Um, had they been vaccinated, they wouldn't be in the hospital, they wouldn't be on ventilators, they wouldn't be dying. This is the truth. The truth is vaccination works. It's worked for polio, for smallpox, many other infectious diseases can be prevented with vaccination. And we have a safe and effective vaccine. And unfortunately, we have a lot of people in the US that are refusing to be vaccinated based on misinformation. One thing you can do to protect yourself and your community and help us in the healthcare setting is to get vaccinated. And we need to have all Americans on the same page so we can avoid needless deaths.
Thank you, Dr. Diaz. Robin, what do you think?
Oh, dear God, please get vaccinated. It's short and to the point. Please get vaccinated. That's really all I have to say. And thank you to everyone who's working in the trenches, because everybody is a rock star.
Sarah, what would you say to your colleagues from coast to coast?
Yeah, just in you know, to tie in with Dr. Diaz and Robin, I would just say, you know, continue to follow the infection prevention measures that the CDC is recommending as far as masking, you know, when you're around other people, and social distancing. We're seeing how much it has made an improvement with other respiratory viruses like the flu last year. So those things really are working, and they're keeping, you know, everyone else safe and free of disease. And so I would just encourage to continue those good behaviors.
Thank you. And I can't help myself, but since Robin, you mentioned this all started during flu season. We know there's a flu vaccine also available, and that is also no joke for some people to get the flu. So a little public health PSA there of moderator's privilege. I'll just add. But thank you all so much for everything that you do day in and day out. We really hope you can get some respite from all of your hard work, and thank you for all that you have done and continue to do. Thanks to your colleagues at Providence, and certainly to the healthcare providers and workers all across the country. So we greatly appreciate your service, and thank you for joining us today.